Imagine this. You are taking a bite of your favorite snack and then all of a sudden you hear crack and something feels off and you run, look in the mirror and boom, your tooth is split. What do you do at this point? Well, before I keep going, make sure you write the code 72, and this is in order to get a free consultation for whitening or implant or even veneers in our office. Welcome to the Wonder Tooth podcast, and my name is Dr. Radwa Saad, and I am a dentist of over 20 years of dental experience. I am the past president of Mercer Dental Society, which is part of the Dental Association in New Jersey and the American Dental Association. I'm also the head of the peer review committee, and I love doing dentistry. I have a master's degree in implant surgery and implant restoration, and I am a cosmetic dentist in Princeton, New Jersey, the founder of Blanche Dental. And feel free to come over if you are in the area or if you want a consultation. We also offer virtual consultation. But today we are going to talk about a split tooth. So what do? What just happened? Oh my God, I was biting a sandwich, a soft sandwich, and then I felt my tooth cracked. And I thought it was a crunchy part, and then I'm looking and it's my tooth. I hear this every day in my office. So what are the causes of a split tooth, or basically a fractured tooth? A cavity, a large cavity. If you have a large cavity, sometimes even if you don't feel like a hole in your mouth, but sometimes the decay, especially if it starts between the teeth, in between, sometimes the whole tooth becomes hollow from the inside, but it didn't break yet. It's completely, totally undermined, but it's just waiting for that moment. Then you're biting on something and then that part is gonna crack, and then you'll be like, okay, I have a huge hole in my mouth. So a lot of patients, when they come and we get x-rays done, and I say, okay, we have a big cavity. Well, but I don't feel fine. I don't have a hole in my mouth. And then I start to show them. I always like to educate patients. So I have those huge, like 50 inches TVs in my office, in each room actually, to show the patients the x-ray. And I'll be like, look at this. Do you see that big thing? They're like, yeah. And I said, well, this is the big cavity, and this is just about to crack anytime at this point. So a large cavity or a large decay can be a cause of a split tooth. What else? Old fillings, old amalgam fillings. I used to be a very big advocate for amalgam filling, and oh my God, it was amazing. It stays forever, for like 30 years or so. But the problems that I've been seeing, I think at this point, it's really outcome the benefits. So what's going on? Basically, I always tell the patient, an amalgam filling or a silver, it's not a silver filling, it's an alloy of different metals. So it's pretty solid. It's like basically as a piece of rock because it's already set. And the tooth around it, especially if it's like in the middle part of the tooth, the surrounding structures, the tooth itself is connected to the bone by a ligament. So it acts like a cushion. So imagine you're eating, you're functioning, you're chewing, and then there is a cushion. But that metal part is not giving in. It doesn't have any flexibility, but the tooth is actually kind of moving inside, with the little ligament. So what ends up happening, micro cracks, very thin micro cracks starts to happen around the margins of the tooth. So basically the connection between the tooth and the filling, you can start to see very thin black line. If you have big silver filling, especially in your lower jaw, go get a mirror and look closely. And if you start to see like very thin black line around that, that means that you have some basically fracture lines starting to happen there. And there are micro cracks. But of course, with time and, you're eating, you're functioning. I love this. Give me a crunchy. I love crunchy stuff. I love nuts. I love, popcorn in the movies. It was amazing. Or give me that pizza crust. Well, boom. And the tooth cracks. And why is that? Because of all those micro cracks that are already existing around existing large silver filling. And what else? Of course, if you love to bite on like really crunchy food, and I'm talking crunchy, like whole almonds, I tell the patient, we love it, it's a healthy snack. Oh my God, what do I do? Well, listen, my husband broke his tooth on an almond, and I am a dentist, and I kept telling him, get the sliced one. We have the sliced one, we have them. But he just loved that crunchy feeling. Well, he cracked his tooth and it was so bad that I'll tell you later on how was the line of treatment. But basically very crunchy food can create micro cracks in the teeth, and then all of a sudden it can crack. So now we spoke about a large cavity or already an large existing filling, especially the silver fillings, or grinding or basically clenching also can cause that. So what is grinding? What is clenching? It's basically nocturnal paroxysm. Okay, so what does that mean? It means when you are sleeping at night. Nocturnal paroxysm, it means when you are at nighttime and you start to kind of put pressure, and then you start to grind your teeth side to side, or even sometimes forward. And you are sleeping, so you can't really, but your partner can sometimes say, oh, I hear you, like, I think you're grinding your teeth. How can we tell as dentists? Well, we see like pretty much like flat surfaces on the tooth. So your tooth is supposed to have elevation and depression and like mountains and valleys. We see like a black line, like a field, complete flat field. And then usually we see it mostly also on the canines. Your canine is supposed to be nice and pointy, if you have a dog or a cat, you see how they have very pointy canines to help them cut and cut the food. In your scenario, they're flat, they're gone. And what did you do? Well, you've been grinding so hard. What's the difference between this and clenching? Clenching is when you just kind of squeeze your teeth very tight together. So there are no flat lines, but they're just kind of intercuspating. And then sometimes when you put your hands on your cheeks and you kind of clench, you feel like, okay, this is clench. By the way, I clench, so I wear my retainers because I had braces. So let me tell you, sometimes I wake up at night and I'm like, I can feel my jaw is like this. But this is like out of the scenario, but basically an old filling, a cavity, grinding, clenching, and also biting on hard food. What else? Like a trauma. Well, I'm eating, this is delicious, and boom, you hit it with a fork. Of course, the tooth is gonna crack. Like, what are you thinking? You have to be careful, guys. You gotta treat your teeth with a lot of respect. So these are some of the causes of a split tooth. Not all of them, but I remember one time I had a patient, she was in a restaurant actually, and she bit something and she heard something, and she came to me and I said, that tooth is not restorable at this point. She was very upset. We fixed it. We became friends. She's been my patient for like over 10 years now. But it's like part of the story. And another patient who loved to eat crab legs, the whole big crab, and he would crack them with his teeth. Cracked three teeth, and it was not cheap. So he was like, okay, this was the most expensive crab legs. I said, well, you gotta be careful from now on. Okay, guys, these are some of the causes of a split tooth. Now, what would you do? Oh my God, I cracked my tooth. Am I gonna panic and scream and faint and pass out? Oh my God, help me, I cracked my tooth. What do I do? No, you have to really just stay calm. Nothing is gonna, you're just gonna relax, take it easy. If it was you or one of, your partner or one of your friends or one of your kids, just relax, take it easy, you have to stay calm. Then the second most important thing is, we don't want bacteria now to get into the tooth. So what do? Very easy. Go to your kitchen, get a little bit of salt, like kitchen salt. Get a glass of warm water, put a teaspoon of salt, and just start to rinse that area really well. And why is that? Because we want to minimize the bacterial load in that area. We don't want the bacteria to get in and basically attack it and then cause a lot of problems down the line. So remember, we're going to stay calm. We're going to try to rinse with warm salt water. And what else? If there is a little bit of pain, take a couple of painkiller, take some Advil, take some Tylenol. Of course, if you have medical problems, you have to make sure, of course, you would know if you are allowed to take some Motrin or Advil or Tylenol. If you cannot take that, or, if you have any stomach issues, make sure you eat some yogurt or take some probiotic, because any medication can really upset your stomach really well. And then what do you do after? Well, you're just gonna avoid eating on that. This is pretty normal, straightforward. You're just gonna, okay, I broke my tooth here. I don't wanna eat on that side. We're gonna eat on the other side. And then you're gonna call your dentist like immediately and try to get an appointment, like an emergency appointment. And when you call, make sure you say, I broke my tooth. I need to be seen immediately. And they will fit you in. If not, you call us, Guy. We are in Princeton, New Jersey, and we're gonna see you on the same day. We'll fix that tooth on the same day. Okay? Make sure you subscribe, like, and share, and make sure you write in the show notes down here. Basically follow us, and yeah. Anyway, line of treatment. What are we gonna do? So it really depends now on how big that crack is. So remember, I said my husband broke a tooth. I had a patient who cracked his teeth on crab legs, and another patient, she was at the restaurant. So what is the line of treatment for a split tooth or a cracked tooth? So it really depends. So if the split or the crack or the chip is still in the enamel, very thin, basically like a sliver of the tooth is gone, we don't really do nothing at this point. If it's something very tiny, you just come to the dentist, they're just gonna smooth it out and you're good to go. Especially if it's in the back. If it's in the front, it's a different story, obviously, because you don't wanna walk around with the front tooth that's chipped. But if it's in the back, if it's a very thin part and it's still in the enamel, in the outer surface of the tooth, we just smooth it out because you don't want anything sharp, you're done. What if it's something a little bit bigger than that? So if it's a little bit bigger than that, we can do a filling, like basically it's bonding, because it's not if it's a cavity, then of course we have to fix the decay. But if it's just, like a chipped part, and it reached the dentin, so we have to put a filling. Or if you have an old filling, we have to replace that, depending on how much of the tooth structure is still left. So sometimes, mostly if it's like in a premolar, which is the teeth, these are the teeth right behind your canine. It looks like this, it's like two surfaces. If one of them is gone and the other is still there, that means we have to cover this, we have to put a crown. Because if it's a big fracture, especially also, premolars are smaller teeth. If it's in the molar area, which is the big molar in the back, depends on how big the crack is. So if the crack took like 1/3 of the tooth, then yes, we need to cover the tooth as well, which is a little bit much more than just to put a filling. So remember, if it's a small chip, sometimes we just smooth it out, we're good to go. You don't even need to be numb for this. If it's a little bit, deeper and it's, bypass the enamel and it's inside the dentin now, so we have to kind of put a filling there or put some bonding. Now, if it's a little big part of the tooth structure is gone, so we have to do a full coverage of the tooth now. What does that mean? A crown, a cap. What is a cap? So a cap is basically when we go and basically shave the 360 degrees and cover the whole tooth to protect the tooth. Okay? Now, if it's a front tooth and you chipped a good big portion of it, like a large part is gone, a filling will not stay. So what do? Do I put a crown? No, you can still get away with the veneer. And a veneer is much more conservative than a crown. It's very, very thin. It's a very thin layer of porcelain that we put on the outer surface of the tooth, and basically it wraps around the edge. And it's much more conservative than a crown. It's minimal reduction, but it can save your tooth, and it's more permanent than just a filling, because the minute you bite on this, it's gonna crack if it's a filling. Okay, so now we understood the difference between if it's a small crack and if it's a little deeper towards the dentin, and it depends on the amount of tooth structure. Let's say it's really deep and it went to the nerve now. Well, now we're talking about a root canal. So what is a root canal? It's a good question. So a root canal is basically when the crack has involved the part of the nerve, which is, we call it the pulp. So that means this is exposed now. So we have to go and basically clean that area, basically get rid of the nerve and clean the walls inside and put a filling inside where the nerve used to be, and then put a crown. Build the tooth first and then put a crown to cover everything. And why a crown is very important? Because the tooth now is basically has a big hole on the top, because there was already a cavity or the crack, and now we had to drill even more to do the root canal. So now it's a big hole. So if you bite something, I see a lot of patients, they get a filling and part of the tooth is gone, and I'm like, why you didn't get a crown? Oh, they didn't tell me. What, you guys have to, now you know. That's why we have this podcast, because I want you to learn. So if you get a root canal, make sure if it's a lot of tooth structure is gone, you really have to get a crown on it. Because what's gonna happen next is the tooth is gonna split, and then we'll be like, I'm talking split in half, and then we'll be like, well, the tooth is done now. So remember, my husband with the almond, and the patient who went to the restaurant and basically half of the tooth was gone. We had to pull the teeth because they were not restorable. So in the case of my husband, his tooth was actually split side to side, like completely, totally halfway, like done. So you cannot fix that. We're not with a root canal, nothing. This is basically, we take the tooth out and we clean the area and we put whether an implant or a bridge. But it's very important to put something there, because if we don't, the teeth on the side, they're gonna start to shift and then the whole side will be just kind of done, okay? So now we learn what to do with the split tooth. Okay, how do we prevent that? The very easy question, very, very easy question. Well, of course, you have to do your dental checkups. You have to go to see your dentist every 6 months, or depending if you have gum problems, you go more than that, like every 3 months or 4 months. But usually you have to go every 6 months to check. And it's important to take x-rays. Are x-rays supposed to be done every 6 months? No, but once a year. Okay, guys, and x-rays are important to be done, because as dentists, we don't have x-rays in our eyes. I cannot see between the teeth. I don't know what's going on. I can't see that. I cannot tell if there is an infection in the tooth without an x-ray. I cannot. I cannot see if the nerve is involved or not. I cannot. I cannot see if there is bone loss. I have to get an x-ray. Because a lot of patients, they ask, oh, I don't want x-ray, it's radiation. Well, if you walk a little bit outside in the sun, well, you are getting the same amount. And especially now, everybody is doing digital x-ray. So it's very minimal radiation. So number one, you have to go see your dentist every 6 months. And when do we get x-rays? Once a year. Okay, very important. What else? Get a night guard. Remember when I said if you are grinding your teeth or clenching, you have to wear something to protect your teeth now. And if you have, like, of course, cavities, get them fixed. If you have old fillings with crack lines, if you have, this is very important now, guys, if you have an old silver filling and you see like very thin crack lines around, this is the time to go to your dentist and be like, I need you to fix this. So whether they, depending on how big the filling is, whether they are going to replace it with a white filling, a composite filling, because composite is more forgiving than, you know, than an amalgam or an alloy, or they might even put a crown on it. So you have to go get your teeth checked. Look in the mirror right now and look. If you see like a very big black silver filling in there and you see black lines around it, that means that you have cracked lines in the tooth, and that tooth needs to be fixed as soon as possible. Okay, what else? Take it easy on crunchy stuff, please, okay? Let's try to save those pearly whites. So, alternative, almonds, get the sliced almonds, get chopped, you know, get the chopped nuts. The almonds are nice and I like them, but you know what? You can get the slice on, or you crack them yourself, do something, but don't eat like whole crunchy stuff, please. Popcorn kernels, absolutely not. Absolutely not. Toasted bagels sometimes. Bagels actually crack teeth. And it's not really, but because of course there was already a crack in the tooth, but they crack teeth a lot of times. Of course, don't try to open a bottle with your, you know, with your mouth. Avoid, you know, hitting the fork. If it's a really delicious food, just avoid hitting your mouth with the metal fork, please. And for people also who play sports, especially like weightlifting, okay, I had a patient the day before yesterday, big muscular guy, and he is doing weightlifting, and I said, do you wear a sports guard? No, but I do feel like I clench. Oh yeah, you know what? I had a patient, and he's probably watching me now, very, 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 very nice guy. His neck is like this big from weightlifting. He's a big muscular guy. And he used to clench. He wasn't wearing a night guard. So what happened? He had a front tooth, it cracked like it split, that it was not restorable, and ended up getting an implant. It was a whole big drama. So protect you. Do yourself a favor, please. Get a sports guard. You can get something temporary from the store. It's called a sports guard. So sports guard is different than a night guard. And why is that? So sports guard is, you're supposed to do it if you are doing any like not aggressive, like a sports, like, you know, martial arts, or you're doing weightlifting or something that you are going to clench or basically get hit in the mouth. So what do? So the sports guard is supposed to cover your teeth, all of your teeth, and even part of the gum. So if I look like this, so it should cover all of that. A night guard is only for nighttime, and for the front teeth, it's supposed to cover only 2 to 3 millimeters of the edge of the front teeth, just like here. But from the back, it's supposed to cover pretty much all of the teeth from the back. And why do we do this? Because you don't want it to get engaged between. So the teeth are like this. We have something in between. It's called the embrasure. You don't want the night guard to grab onto this, and then it's going to be impossible to pull this out. So what is it? The night guard, let's go back. The night guard is basically, it covers around 3 millimeters of the edge of the tooth. From the front, around 3 millimeters, and from the back, it covers the back part of the tooth and until basically part of the gum. While the sports guard, because it's a softer material too, so it can basically cover all of the teeth and even part of the gum, and it helps to splint the teeth together. Okay, a night guard, you better get the hard night guard, not the soft one. The soft one is mushy, it's not gonna do anything, especially if you grind your teeth. Get the hard night guard. The soft one is only for people who have like veneers or something that can crack if you put too much pressure. Okay, so I hope you guys kind of enjoyed this episode about the split tooth, and I just hope you guys basically, let's prevent it from happening. And don't forget to subscribe, like, and share, and write in the comments below here if you had any problems, or you cracked your tooth, or you don't know what to do. I can help you. Even though we are in New Jersey, if you are in a different city or a different state, feel free to, we can do a virtual consultation. So make sure you send me a comment down below here, and make sure you take care of your teeth so that they can take care of you. Until then, keep smiling with Dr. Saad. Have a good one, everyone.